So as we have discussed till now, you will be able to address that an infectious disease is an illness. It is an illness that is caused due to a specific agent or its toxic products. Many a times, the entire agent is not required. Only one exotoxin of the bacteria is sufficient to produce a particular disease. So it's an illness that is due to a specific agent or its toxic products that arises through transmission. So transmission is a key element in infectious disease epidemiology. So an illness due to a specific infectious disease agent or its toxic products that arises through transmission of that agent or its products from either an infected person or an animal or a reservoir. So it will have to come from either an infected person, or it may come from an animal, or it may come from a reservoir. And it will go to a susceptible host. It will go to a susceptible host. And while it does this journey, it can either move directly or it can move indirectly through an intermediate host, vector, or the environment. Okay. So this is the definition of infectious disease that is given in Park. I've tried to compartmentalize it into its component systems. So going back again, an infectious disease is an illness that is caused by a specific infectious agent or its toxic products that arises through transmission of that agent or its products from an infected person, animal, or reservoir to a susceptible host. Now the route is either direct or indirect to an intermediate plant or animal host, vector, or the inanimate environment. Okay. So whenever we talk of transmission for any infectious disease, you'll be able to appreciate that there is a chain of infection. There is definitely a pathogen. Now this pathogen will have a reservoir. From this reservoir, the pathogen has to exit through a portal of exit. Then it has to be transmitted to a susceptible host where it will enter through a portal of entry. And this will ultimately lead to establishment of disease in a new host. Let us take the example of, for example, let us take the example of common cold. So in common cold, what is the pathogen? The pathogen in common cold?
Rhinovirus.
Maybe it's an adenovirus or a rhinovirus. Okay. I went with adeno. I could even go with rhino. So it's probably adenovirus or a rhinovirus. What is the reservoir? The reservoir here are the cases of the disease. The cases who already have common cold. From these, it will have to exit through a portal of entry. Now, what will be the portal of exit? For common cold, the portal of exit, either they will sneeze or they will cough. So the portal of exit will either be nose or the mouth. And through this portal of exit, it will then be transmitted. How will it be transmitted? It can be transmitted directly by a droplet. If it is transmitted directly by a droplet, what will be the portal of entry? The portal of entry can be the conjunctiva of the host.
Nose দিয়ে হতে পারবে.
It can be the nasal mucosa, or it can be the oral mucosa. This will be the portal of entry. And from this portal of entry, once adenovirus is there in the susceptible host, it will gain access to the lymph nodes and then cause inflammation and infection there. And that will ultimately lead to this person developing swollen glands, sore throat, cough, excessive mucus secretion, and all of that. Now, just like it is directly transmitted by droplet, it could also be transmitted indirectly by aerosol. There it would not land on the conjunctiva, but it would move through the nasal mucosa or the oral mucosa. Is it clear? Chain of infection.
তাহলে
Yes.
তাহলে যদি কারোর একটা রোগ ধরে নি, যে একজনের হয়তো আননোন একটা ডিজিজ হয়েছে, ধরে নিলাম স্কেবিজ হয়েছে, স্কেবিজের মানে চেনটা কি হবে?
Scabies chain of infection কি হবে? Here the pathogen is what? The pathogen is the mite. The reservoir will again be the person. The portal of exit will be skin. The transmission will be from skin to skin contact, direct. The portal of will also be skin. And establishment of disease in the new host will be by invasion of the webbed spaces of the fingers or the wrist or the elbow, from where the mite will start laying its eggs and having new babies of the mites. That will be the chain of infection. Scabies is an infestation. It occurs in the skin primarily. Okay, Dipta?
হ্যাঁ, ঠিক আছে।